Hello everyone, and welcome back to MediInsights, unlocking the wonders of wellness. Today's topic is incredibly important for women's health, cervical cancer. We'll explore what cervical cancer is, its symptoms, causes, diagnosis, treatments, precautions, and essential advice for those affected. Whether you're seeking knowledge for prevention or supporting someone going through it, this video is your guide. So, let's dive in to better understand how to protect ourselves and others from this condition. Cervical cancer occurs in the cells of the cervix, the lower part of the uterus that connects to the vagina. It falls under the category of gynecological cancers, which affect a woman's reproductive organs. Cervical cancer most commonly begins in the thin, flat cells lining the cervix, called squamous cell carcinoma, or in the glandular cells called adenocarcinoma. Next, signs and symptoms of cervical cancer. In its early stages, cervical cancer may not show any symptoms. However, as it progresses, common signs include abnormal vaginal bleeding, unusual vaginal discharge, pelvic pain or pain during intercourse, and frequent urination or discomfort while urinating. These symptoms may also indicate other conditions, so it is essential to seek medical advice. Next, causes of cervical cancer. Cervical cancer is most commonly caused by persistent infection with certain strains of human papillomavirus, particularly HPV-16 and HPV-18. Other contributing factors are smoking, weakened immune system, long-term use of oral contraceptives, multiple full-term pregnancies, early onset of sexual activity. HPV is primarily spread through sexual contact, making vaccination and regular screenings vital for prevention. Next, diagnosis of cervical cancer. Diagnosis of cervical cancer typically involves several tests and procedures. These are Pap smear to detect precancerous changes in cervical cells. HPV testing to identify the presence of high-risk HPV strains. Next, colposcopy, which uses a special magnifying device to examine the cervix more closely. Next, biopsy. If abnormal areas are found, a small tissue sample is taken for further examination. Medical specialists involved in the diagnosis include gynecologists, gynecologic oncologists, and pathologists. Next, treatments of cervical cancer. Treatment options depend on the stage of the cancer. Early-stage cervical cancer can often be treated with surgery, such as a hysterectomy or a cone biopsy. In radiation therapy, healthcare provider uses high-energy beams to kill cancer cells. In chemotherapy, drugs are used to destroy cancer cells, often combined with radiation therapy. Targeted therapy, which aims at specific cancer cells or processes in the body that support cancer growth. Next, precaution of cervical cancer. Precautions for preventing cervical cancer are given below. Getting vaccinated against HPV can significantly reduce the risk. Routine pap smears and HPV tests can detect precancerous conditions early. Using condoms and limiting the number of sexual partners can reduce the risk of HPV infection. Smoking is a known risk factor for cervical cancer, so avoid it. Next, advice for cervical cancer patients. For patients diagnosed with cervical cancer, here's some advice. Work closely with your healthcare team to understand and follow your prescribed treatments. Dealing with a cancer diagnosis can be challenging, so don't hesitate to join support groups or talk to a counselor. Focus on a balanced diet, regular exercise, and adequate rest to strengthen your body during treatment. Ask your doctor questions, stay educated about your condition, and be involved in decisions about your care. By the end of this video, we hope you have gained a clearer understanding of cervical cancer, its causes, and how to manage it. Remember, early detection through regular screenings can make all the difference. Don't forget to like, share, and subscribe to MediInsights for more health and wellness content. Stay informed, stay healthy, and we'll see you next time.